When we talk about European public health, I would like to tell you a little bit about how we define European public health at Maastricht University. We define the European in European public health at 3 levels. The first level is the level of comparing the health status and health systems of one European country to another. This is essentially a process of comparative health, and our graduates are trained in comparing the data from one country to another and looking at the differences in the health systems. Oftentimes this can be very helpful in helping us realize what are better solutions or worse solutions in terms of promoting health. Now the second level is what we would call the level of Brussels policy, or the European Union itself, the institutions, the organs that are located in Brussels, but as well the Treaty of Europe, which was signed right here in Maastricht, in fact less than 1 kilometer from where I'm standing right now, in 1992, which formed the basis of the European Union as we know it today. So in this program you will gain insight into what the EU is, what are its institutions such as the Commission, the Parliament, and the Council, and what are its authorities according to the treaty, which is its legal basis. Finally, the third level, in European public health, we look at the role of the European Union at the global level. The EU is a large geopolitical unit that strongly influences the global agenda in terms of public health. We've seen how important that can be as well now over the course of the coronavirus pandemic, which has illustrated very strongly how infectious disease knows no borders. The transmission of that can go very quickly, and therefore involvement at the level of global health is a very important part of Europe's agenda in public health as well. So again, the 3 levels at which this program is European public health are 1, comparative health, 2, Brussels itself and everything to do with the EU, which you'll be learning a great deal about, and finally the role of the EU at the international level. Now, in talking about conditions, one of the things that we can see is the importance of the environment in health. And part of our program focuses on the role of the natural environment. We see here Frans Timmermans, who is leading the new Green Deal at the European level. We know how important climate change is already and will continue to become in determining many of the factors that influence our health, such as food supply, water, whether that be too much water or too little, as well as things like heat waves. Finally, public safety, and for example, nuclear energy and the stability of energy production, and also the transfer of materials associated is an important part of guaranteeing people's health status. Also lifestyle. I mentioned smoking earlier. So issues like smoking, diet, exercise are very important, and our food supply is part of that. Now, food is not only a choice, something that you choose to eat, but it's also a question of which options you have. What's available in the grocery store, what has been added to it, and what is the overall safety of that food supply and security of the food supply. All of these issues relate to our lifestyles in the EU and are part of the European public health agenda and program. So in this program, we talk about the European Union, and when we talk about Europe, we generally define it as the European Union post-Brexit now with the 27 member states. And you can see a map here of the European Union as of the current time. Now, we also from time to time choose the larger entity of the World Health Organization definition of the European region, which includes Russia and a number of the Eastern European states that are not members of the European Union. So in the program, students use both levels of analysis to look at European public health issues and questions.